Norovirus causes 685 million illnesses and 200,000 deaths worldwide each year. This is clearly the population of whole Europe. This winter vomiting bug can ruin your family gatherings. It causes chaos and sickness. As a physician who has battled norovirus 3 times, I can tell you, it spreads with alarming speed. It's especially dangerous for the vulnerable, like children and the elderly. This video will cover 5 key areas. Number 1, gastrointestinal infections. Number 2, the facts about norovirus and its spread. Number 3, when you should seek medical help. Number 4, effective treatments. Finally, number 5, guidelines to protect yourself and your loved ones. I want to share timeless knowledge. This wisdom can help anyone, parents, teenagers, business owners, or the elderly. Knowing how to handle gastrointestinal infections is crucial. By the end, you will have practical strategies to keep you and your loved ones safe for life. Gastrointestinal infections hit like a storm. One moment you're enjoying a meal, and then next your body turns against you. You suddenly face nausea, vomiting, and diarrhea. But what exactly are these infections? How do they invade our bodies and disrupt our digestive systems so quickly? They are caused by various pathogens, including viruses, bacteria, and parasites. These invaders can seriously disrupt your digestive system. Let's explore how easily these infections can spread. Picture this. You forget to wash your hands after shaking hands with someone unwell. Later, you eat a sandwich, and within hours, your stomach is in turmoil. Nausea washes over you. Soon, you're rushing to the bathroom as it turns into vomiting and diarrhea. That's how rapidly viral infections like norovirus can take hold. These infectious viruses spread primarily through contaminated food or water, or close contact with infected individuals, or their vomit, or through touching contaminated surfaces. Imagine touching a doorknob and then not washing your hands before eating. Common situation when you come home. A while back, someone with norovirus touched it right after throwing up in the toilet and not washing their hands on the way out. In that moment, you've sealed your fate. Your body reacts swiftly to these invaders. The immune system springs into action. It makes antibodies and sends white blood cells to fight the infection. This immune response is what leads to these symptoms you experience. It's vital to know how these pathogens operate. What might you experience with gastrointestinal infections? Nausea, vomiting, diarrhea, abdominal cramps, fever, allodynia, general malaise, which is fatigue, muscle aches, and sometimes sleeplessness. But why is hand washing so important over disinfecting? You'll find out soon as we explore some viruses like norovirus, because norovirus is a non-enveloped virus. Unlike many other viruses, it can persist on surfaces. It can even resist some disinfectants. This makes it hard to kill. Norovirus spreads fast. Consider this. An infected person can release millions of viral particles into the air or on surfaces in a single episode of vomiting or passing a stool. You only need 18 to 28 of these particles to get sick. Symptoms hit fast, usually within 12 to 48 hours after exposure. You might face intense vomiting, diarrhea, and stomach cramps. The pain typically occurs in the upper middle abdomen, especially early on or when throwing up. It can also present throughout the lower abdomen, especially when diarrhea is present. Some people also experience sleeplessness or allodynia, which is a painful sensitivity to touch. You could feel so achy that even your skin hurts. A fever, muscle aches, and fatigue may hit you too. Yet with knowledge in this video, you will know what to do. Here is a big red flag. A very strong pain around the navel or in the lower right abdomen. It can be appendicitis. This condition has similar symptoms to norovirus, but requires immediate medical attention. Here is a list of norovirus characteristics. It will help you recognize this infection better. Norovirus is a non-enveloped virus. It is resilient and hard to kill. It can survive on surfaces for weeks and withstand many disinfectants. Number 2. High infectivity. 18 to 28 viral particles are enough to cause infection. Number 3. Rapid spread. Outbreaks often occur in crowded places. Contaminated food and water are the main transmission routes. Number 4. Sudden onset of symptoms. Symptoms can appear within 12 to 48 hours after exposure. Number 5. Quick recovery. Most individuals recover within 1 to 3 days. Norovirus is not the only concern when it comes to gastrointestinal symptoms. There are other symptoms that can suggest a more serious condition. Now, we will talk about the most important warning signs that say it's time to get help. Recognizing these signs can make or break your chances for swift recovery. Recognizing when to seek medical help is crucial. Some symptoms can mean that something more serious is happening. Imagine a teenage boy who feels a bit off after a family barbecue. He spends the night with a stomachache and an extremely high fever of 41.5 degrees Celsius. It is not responding to medications well. He has intense diarrhea without vomiting. At first, it seems like a classic case of food poisoning, but the next day, the symptoms did not resolve. He got worse. He had a bacterial infection, salmonellosis, most likely from undercooked meat. Early intervention prevented a more serious outcome. Consider another case, an elderly man with a sharp abdominal pain, but no fever. He brushes it off thinking it will pass. Days go by and his symptoms worsened without any relief. He stopped having stool and got weak. Finally, after over a week, he was taken to the ER. Examination revealed a serious gastrointestinal obstruction caused by late-stage cancer that metastasized. Tragically, he passed away only 10 days later. These stories highlight the importance of listening to your body. Here are the red flags that say it's time to get help. Severe abdominal pain. If it starts near the navel and moves to the lower right abdomen, it could suggest appendicitis. Very stiff, hard belly. These might indicate a bowel obstruction needing immediate care. Blood in vomit or stools. This can cause signal serious conditions that require urgent attention. High fever. A fever above 38.3 degrees Celsius that doesn't respond to the treatment should be evaluated by a doctor. Lack of stool for several days. If you are experiencing this along with intense vomiting, it's a major signal to seek help. Persistent and worsening symptoms. If you feel worse over time instead of getting better, don't wait to get checked out. Remember, the presence of one of these symptoms does not guarantee something bad. It is a good reason to consult a healthcare professional though. Golden balance is key. Going with everything to your doctor is bad. Not going when you should, even worse. Now, let's focus on the available treatments. What can you do to manage symptoms and aid recovery? These include probiotics, medications, and natural remedies. Did you know that Saccharomyces boulardii was discovered from a native tribe in Southeast Asia? The locals used it for digestive issues. Researchers turned this jungle remedy into a pill. This probiotic has shown promising results for people suffering from gastroenteritis. Research shows that Saccharomyces boulardii can greatly reduce diarrhea in children with gastroenteritis, on average by about 1.03 days, according to a systematic review that included over 1,200 children. Probiotics, like Lactobacillus plantarum 299V, act like friendly reinforcements for your gut. They help restore balance after a virus disrupts your digestive system. Research has demonstrated that LP299V can stimulate mucin secretion. Increased mucin secretion contributes to a better protective mucus layer in the gut. This helps trap viruses and stop them from sticking to the intestinal cells. Also, LP299V may help restore a healthy microbiota after an infection. Other treatments can also help you ease discomfort. Simeticone is effective for relieving gas and bloating, making symptoms more manageable. For bacterial infections, medications like nifroxazide and rifaximin are key players. Nitazoxanide has been found to effectively inhibit norovirus replication. It greatly reduces symptoms of gastrointestinal infections from protozoa and helminths like Giardia lamblia and Cryptosporidium. Overusing medications can lead to complications or prolong the symptoms. Here is a list of specific treatments for effectively managing GI infections. Probiotics. Saccharomyces take 1 to 2 capsules, 250 to 500 milligrams, twice daily for up to 7 days. This can help reduce diarrhea duration, especially in children suffering from gastroenteritis. Lactobacillus plantarum 299V. Take 1 capsule, about 10 billion colony-forming units, once a day for 10 to 20 days after infection, basically until the end of the package you buy at your local pharmacy. This helps restore gut balance and immunity. Simethicone. Dosage for adults. 80 to 125 milligrams taken 4 times a day as needed. Ad hoc. Usually after meals and at bedtime. This helps relieve gas and bloating. Nitazoxanide. Dosage for adults. 500 milligrams taken twice daily for 3 days. This medication can help reduce symptoms associated with viral gastroenteritis. Rifaximin. Dosage. 200 to 400 milligrams taken 3 times a day for 14 days. This is effective against bacterial infections in the gastrointestinal tract. Diosmectide. Dosage. Mix 1 packet, typically around 3 grams, with half a glass of water. Take it 3 times a day for up to 5 days. First day, the dosage can be doubled. It helps to absorb toxins and protect the gut lining. Trotavirine. Dosage. 40 to 80 milligrams taken 3 times a day as needed. Ad hoc for pain relief when experiencing strong cramps. Carbomedicinalis. Activated charcoal. Dosage 800 to 1200 milligrams after meals as needed. It helps reduce gas and bloating. Use cautiously to avoid gastrointestinal obstruction. Use only as a second or third line of treatment. And the most important one, prevention and treatment of dehydration. Children under 24 months, 50 to 100 milliliters of oral rehydration solution after each loose stool. Aim for approximately half a liter daily. Children aged 2 to 10 years, 100 to 200 milliliters of ORS after each loose stool. Aim for around 1 liter a day. Children over 10 years and adults, 200 to 400 milliliters of oral rehydration solution after each loose stool. Aim for around 2 liters daily. Let me show you what happens when you're prepared versus when you're not, through Emily and Mark's stories. Their stories will make it easy to follow along, especially if you're going through it firsthand right now. Both had been exposed to norovirus at a family gathering. Their experiences showed why one key thing makes all the difference. Emily, a 20-month-old girl, woke up with a stomachache and a watery diarrhea. Her mom took a quick look and noticed she was a little pale and felt warm, but had no fever. Crucially, she checked and there was no blood in her stool. All signs pointed to the norovirus from yesterday's gathering. Meanwhile, Mark, a 39-year-old adult male, was experiencing intense abdominal cramps. He vomited several times over the night and had whole body pain. As he described it, "Even my hair hurts." He could barely move, yet he was completely alone at home. Intense thirst and weakness were setting in. And when he managed to look in the mirror, he noticed his skin looking particularly dull. With no medications and deteriorating symptoms, he finally called his family the next day. This is how their situations developed differently based on preparation. Emily's mom knew exactly what to check. She performed 3 critical dehydration tests. Number 1, standing skin fold test. She pinched the skin on Emily's belly, watching carefully. It swiftly returned to normal, indicating no severe dehydration. Number 2, fingernail capillary test. She pressed down on Emily's fingernail until it turned white, timing the color return. Less than 2 seconds, showing good circulation. Number 3, mouth check. A thorough look revealed Emily's mouth was slightly dry, but not alarmingly so, revealing mild dehydration. When Mark's sister arrived the next day, she found him significantly weakened. She immediately began the same critical 3 assessments. Number 1, standing skin fold test. When she pinched his skin, it took a worryingly long time to bounce back, a clear sign of moderate dehydration. Number 2, fingernail capillary test. The color took just over 2 seconds to return to his fingernail, suggesting compromised circulation. Number 3, mouth check. His mouth was noticeably dry and sticky, confirming significant dehydration. Here's how preparation impacted their stories. Emily's mom immediately reached for their well-stocked medicine cabinet. She started with precisely measured oral rehydration solution, the most crucial one. She went for 75 milliliters after each loose stool. She used Saccharomyces boulardii capsule, dissolving the contents in water and giving once a day. She maintained careful monitoring of Emily's hydration status. She documented each episode of diarrhea and fluid intake. Mark's sister, on the other hand, had to start from absolute zero. She had to prepare a large batch, 15 packets of ORS dissolved in around 3 liters of water. She created a strict 4-hour drinking schedule to combat his moderate dehydration. She administered 250 milliliters of ORS after each episode of diarrhea and vomiting. She provided him with 1 capsule of Saccharomyces boulardii twice daily. She also mixed 1 packet of diosmectite with half a cup of water and given him 3 times daily. She constantly monitored him for any warning signs that might indicate a need for immediate medical attention. The difference in recovery was striking. After just 1 day, Emily felt well enough to play again. Her mom's quick response and having medications readily available at home had made all the difference in her swift recovery. It took Mark 3 full days to regain his strength. His vomiting finally stopped and his energy returned, but his lack of preparedness had significantly prolonged his suffering. 2 identical viral infections, 2 drastically different recovery experiences. The only difference being prepared with both knowledge and supplies. This brings us to the 2 crucial habits that can decrease your chance of all of this happening to you by over 90%. But first, you must know which medications to have at home for gastrointestinal infections. This is a good start for a home emergency kit. Number 1, oral rehydration solution, essential for preventing dehydration. This is the most important one and the only truly necessary you must have. Probiotics, Saccharomyces boulardii for reducing diarrhea's duration, Lactobacillus plantarum 299V for gut health during antibiotics and after GI infections, NSAIDs, but not aspirin, for example ibuprofen, optionally metamizole or paracetamol, drotaverine, or other spasmolytic for pain relief when experiencing strong cramps, diosmectite to absorb toxins and to protect the gut lining. Remember, hand hygiene is key. First thing, when you come home every day, wash your hands well with soap and water for at least 20 seconds. And as this simple act can reduce the risk of infections by 90 to 99%, always wash your hands as the last thing you do before consuming any food. Now that you know how to avoid norovirus, you must know which medicines to avoid during infections. Did you know that certain medications can be incredibly dangerous for children? They should never be administered to them. Click to watch our next video. You will learn about the lethal risks of incorrectly giving a common medication to children during fever. This knowledge can save your child's life.